Most men start their day with a hot cup of coffee. But what if I told you that skipping a simple, mindful check-in with your body each morning, specifically with your penis, might quietly be affecting your energy, confidence, and even your bathroom habits? Hi, I'm Dr. Edward Kenton, a urologist and men's health specialist, with more than 30 years of experience helping men, especially those over 60, regain their vitality and safeguard what matters most: their independence, dignity, and health. The truth is, the penis often gets overlooked during our later years. Many think it's no longer a priority, but in reality, it's a powerful indicator of overall health, especially in relation to heart health, prostate function, and early signs of diabetes. And the first few minutes after waking up, that's when it speaks the loudest. In this article, I'll walk you through 7 practical, doctor-approved morning habits that support your penile health. These aren't just about intimacy, they're about improving circulation, preventing long-term issues, and helping you feel more in control of your well-being. Make sure to read through to number 6. Most men miss this one, but it's actually where we first spot serious warning signs. Catch it early, and you could add years of confidence and function. Let's get started. Morning check-in. Take a look before you go. It might seem odd or even uncomfortable, but I tell all my patients over 60 the same thing. Take a moment to look at your penis each morning, not with shame or judgment, but with awareness. It's understandable if it feels a little awkward at first. We grew up in a time when men didn't discuss these things openly. But in my decades as a urologist, some of the most serious health conditions I've diagnosed started with something as simple as a quiet glance in the mirror. Issues like skin changes, redness, swelling, bumps, or unusual discharge are not just cosmetic. They can be early indicators of infections or even cancer. Catching them early makes treatment simpler and far more effective. I had a patient, Harold, age 67, who spotted a dry patch that wouldn't go away. He mentioned it during a routine checkup, and we caught a condition early enough to treat it without complications. If he'd ignored it, the story could have turned out very differently. And for men who aren't circumcised, it's especially important to gently retract the foreskin and check underneath. This takes just a few seconds, but those seconds could make all the difference. Think of it like checking your car's oil before a long trip. It's not a hassle, it's smart care. This is about respect, not fear, attentiveness, not discomfort. This habit is easy to forget, but once it becomes part of your morning, it feels natural. And here's the truth. The more familiar you are with your body, the quicker you'll recognize when something doesn't feel right. But that's just the first step. What you drink even before stepping into the bathroom plays a much bigger role than most men realize, especially when it comes to your lower body health. Let's dive into that next. If you're still reading and finding these tips helpful, type 1 in the comments below. It lets me know you're here and walking this journey with me. 2. Drink first, pee second. For years, even as a practicing physician, I had the same habit most people do. Wake up and head straight for the bathroom. It was automatic. You feel the urge, you respond. But after working with thousands of older men, I began to see a quiet but consistent trend. The ones who stayed sharper, steadier, and had fewer bladder concerns all did one thing differently. They drank a glass of water before going to the bathroom. It might sound strange why hydrate when you already need to urinate, but there's science behind it. After 7 or 8 hours of sleep, your body is naturally low on fluids. Your blood thickens slightly, your circulation slows, and your kidneys are working with limited resources. A glass of water first thing helps rehydrate your system gently. It sends a signal to your body that it's ready to release waste safely and fully. It also gets blood flowing more effectively in your lower abdomen, including to your penis. Several patients have shared that once they added this simple step, they noticed better flow, less tension when urinating, and even more consistent morning erections within just a few weeks. Think of it like warming up a car engine. You wouldn't drive off after a cold night without letting it run for a minute. Your body deserves the same care. Personally, I keep a glass of room temperature water beside my bed. I take a few sips before I even stand up. It's a small gesture, but one that sets the tone for a better day. Now that your body is rehydrating from the inside, let's get the blood moving from the outside. And don't worry, you won't need sneakers or a gym membership for this next step. Start with a 60-second wake-up stretch. For a long time, I thought stretching was just for athletes or yoga enthusiasts, something younger folks did. But as the years added up, I started feeling stiffer in the mornings, not just in my back or knees, but in how sluggish my circulation felt. That's when I realized a little morning movement isn't just about flexibility. It's about waking up your whole body, especially the parts that matter most for men's health. Just a short stretch helps improve blood flow to the groin and pelvic area. It makes you feel more present, more alert, and more energized. And it doesn't take long, just a minute of focused movement can set the tone for your whole day. The truth is, your penis is a vascular organ, meaning it relies entirely on healthy blood flow to function properly. And after several hours of lying still overnight, especially as we get older, that circulation tends to slow way down. Fortunately, one of the simplest ways to get things moving again is with a light stretch. It takes just 60 seconds. No sweating or fancy movements required. Personally, I like to stand beside the bed, take a few deep breaths, raise my arms overhead, and gently twist my torso from side to side. Then I march in place, lifting one knee at a time with slow, steady control. This gentle movement gets your blood circulating again, activates your nervous system, and delivers the stimulation your lower body needs to support both erectile function and urinary control. What surprises many of my patients is how quickly they notice a difference. Within just a few days of trying this routine, many report stronger urine flow, fewer bathroom interruptions, and even a renewed sense of energy and confidence to start their day. It makes sense like any engine. Once it's warmed up, it performs better. Now that we've got the circulation going, let's talk about one signal your body sends each morning. It's something most men notice, but few really understand. If you're still with me and finding this useful, type 1 in the comments. It helps me know this message is reaching the right people. Pay attention to your morning erection. It says more than you think. This is where a lot of men start to feel a little awkward, or they brush it off with humor. But as someone who spent decades helping men navigate these conversations, let me say this: your morning erection isn't a punchline. It's one of the most honest and consistent reflections of your internal health, particularly your heart, hormones, and nervous system. You don't need to keep a chart or obsess over it. Just be aware. Did it happen today? Was it firm? Did it last as long as it used to? Has anything changed recently? Because that's your body speaking to you. A strong erection upon waking is a positive sign. Your circulation is on point, your testosterone is active, and your nerve signals are working as they should. When that signal disappears, especially over time, it can be an early warning that something deeper may be off. I once treated a man named Dennis, 72 years old, who hadn't had a morning erection in over a year. He assumed it was just part of getting older. But after a thorough checkup, we found early-stage cardiovascular disease. We addressed it before it became something much more serious, all because he brought up a concern many men never mention. I understand this isn't the easiest topic, but once men begin to pay attention to this daily signal, they often feel more empowered, less like things are slipping away, and more like they're taking their health into their own hands. Next, let's turn to something practical: what you do in the shower each morning. Because those few minutes could either be helping you or quietly working against you. 5. Clean but gently. For most of my life, I believed in starting each day with a steaming hot shower and a good scrub. It made me feel refreshed, clean, and ready to take on the world. I didn't give much thought to the kind of soap I used, or how thoroughly I washed every inch I treated my body, like a machine that needed a daily polish. But as I got older, and after treating countless patients with similar habits, I realized that when it comes to the penis, too much cleaning can actually backfire. The skin in that area is delicate. It's naturally protected by a balance of oils and helpful bacteria that keep everything healthy and comfortable. When you strip those away with strong soaps, hot water, or over-scrubbing, you're not doing yourself any favors. In fact, you might be setting yourself up for irritation, dryness, or even infections. I've had older patients come in worried about burning or redness, convinced something serious was wrong when in reality, they were simply washing too hard or using harsh products. These days, I recommend using lukewarm water and a mild, fragrance-free soap. If you're uncircumcised, take a moment to gently retract the foreskin and rinse beneath. No scrubbing, no force. Think of it like brushing your teeth. It's not about pressure. It's about doing it with care and consistency. Treating your body with respect, especially during such a routine task, sends a quiet message to yourself. It's not just about hygiene, it's about self-regard. And when you move through your day with that sense of dignity, everything else begins to shift too. But what you do next when you sit down for your first meal can either build on that care or start undoing it. Let's take a look at what a truly penis-supportive breakfast looks like. You might be surprised. 6. Start with a breakfast that supports your manhood. Like many men my age, I didn't grow up giving much thought to breakfast. It was whatever was quick, satisfying, and familiar, usually eggs, toast, and if I was lucky, some bacon on the side. I never made the connection between what I ate in the morning and how my body functioned later in the day. But over time, both as a doctor and as a man navigating his own aging process, I learned that breakfast plays a much bigger role than we give it credit for, especially when it comes to sexual and urinary health. What you eat when you wake up can directly affect your hormone levels, blood flow, and even the condition of your prostate. And unfortunately, the typical American breakfast, full of processed meats, sugars, and refined carbs, can quietly sabotage all three. Now, I make a different choice. My mornings often start with a bowl of oatmeal, topped with walnuts, chia seeds, and a handful of blueberries. Sometimes I'll add a hard-boiled egg or a slice of whole-grain toast with a bit of avocado. These simple, nourishing foods provide essential nutrients like omega-3s, antioxidants, zinc, and fiber, all of which help support testosterone production, vascular health, and overall vitality. Eating this way doesn't just make you feel good in the moment. It builds a foundation for better function, more energy, and resilience in the years ahead. One of my patients, Harold, age 68, decided to give this a try. He changed just one thing: his breakfast. And a month later, he said to me, "Doc, I had no idea food could make that much of a difference down there." But it does. And often, it's the smallest changes that lead to the biggest shifts. So, if you've never considered what your penis might appreciate first thing in the morning, maybe now is the time. A few smarter choices at the table can improve your health in ways that ripple far beyond the plate. See? Sit less. Move more. I still remember the first time I really noticed it, that stiff feeling in my hips after sitting too long at the breakfast table, reading the morning paper. At first, it seemed harmless. But the more I paid attention, the more I realized something was off. My lower body felt tense, my energy was lower, and I even experienced a bit of numbness in places I wasn't expecting. That's what prompted me to take a closer look at the link between sitting and men's health. What I found changed how I start every day. When we stay seated too long, especially after a full night's sleep, circulation in the pelvic area slows even more. For older men, that restricted blood flow doesn't just make you feel sluggish. It impacts erections, bladder control, and the health of sensitive tissues over time. It can even contribute to pelvic floor dysfunction, something few men talk about until they're already facing symptoms. What worked for me, and for many of the men I work with, is incredibly simple. I set a timer to stand up and move around for 5 to 10 minutes after breakfast. Nothing strenuous, just an easy stroll down the hallway, out to the yard, or around the kitchen. It's enough to reactivate blood flow, reduce pressure in the pelvic area, and help your lower body function more comfortably. One man told me, "That little walk each morning made me feel like myself again." I knew exactly what he meant. I'd experienced it too. We weren't built to stay still all day. Our bodies are meant to move, and that movement is what keeps us strong, steady, and independent as we age. A final thought from Dr. Kenton. If you've made it all the way here, I want to leave you with something beyond tips and routines. Because there's one more layer to this that often gets overlooked. It's not just about your physical body, it's about how you feel inside. If you're still reading, thank you. Not just for your time, but for valuing yourself enough to care, to learn, and to listen. That's the part most men never talk about. For many in their 60s, 70s, and beyond, Even thinking about their body, especially something as private as the penis, feels strange, maybe even a little uncomfortable. But the truth is, giving attention to this part of yourself is one of the most grounded, self-respecting things you can do. It's not about vanity. It's about dignity. It's about honoring the body that's carried you this far and giving it the care it needs to keep going strong. Each of these 7 habits we've discussed, inspecting your body each morning, hydrating before you urinate, stretching to encourage circulation, noticing your morning erection, cleaning with care, choosing a health-conscious breakfast, and standing up to move, they're not dramatic medical interventions. They're quiet, intentional actions. But collectively, they send a powerful signal to your body. You're still here, still attentive, and still committed to living well. I've spoken with countless men who once believed it was too late to change, or who felt embarrassed to even bring up these topics. And yet I've seen those same men regain strength, improve their function, and reconnect with a part of themselves they thought was gone. Not because of some new treatment, but because they started paying attention. They started caring again. You don't need to get everything right. You don't need to fix it all today. But if you take small steps consistently, your body will respond. Your confidence, your energy, and your sense of control are still within reach. You just have to believe you're worth the effort. If this message resonated with you, I encourage you to share it with someone who might need it. Leave a comment and let me know what tips stood out to you, or tell me what topics you'd like me to cover next. Because your story matters, and no matter your age, it's never too late to begin a new chapter. If this video helped you, please give it a like. It shows me this content makes a difference. Share it with a friend, a brother, someone who may be quietly dealing with the same questions. And don't forget to comment below. Let me know which habit you're going to start tomorrow, or drop me a question. I read every single one. Make sure to subscribe and turn on notifications so you never miss the advice, tools, and encouragement you need to stay healthy, confident, and in control of your life. You're not alone on this journey, and your best years can still be ahead. In this article, I'm going to walk you through 7 practical doctor-recommended habits that you can start every morning. Simple steps that support circulation, reduce long-term risks, promote sexual health, and help you feel more in control of your body. And don't skip number 6. It's the one most men tend to overlook, but in my experience, it's where we often spot the very first signs of deeper problems. Address it early, and you might add years of better performance, comfort, and confidence to your life. Before we dive in, if you're finding this content helpful, leave a 1 in the comments. If not, type 0. Your feedback helps me know how to improve. And if you haven't already, make sure to subscribe and turn on notifications so you never miss a piece of advice built specifically for your health, strength, and independence. Let's get started. Here's the very first thing every man over 60 should do for his penis, right after waking up. It's quick, it's simple, and it could make a bigger impact than you realize. 1. Morning inspection. Look before you go. This might sound unusual, maybe even a little uncomfortable, but it's something I encourage every one of my older patients to do. Take a moment each morning to observe your penis, not with judgment or worry, just with awareness. For many of us, especially those raised in a time when men didn't talk about these things, this kind of habit can feel unfamiliar. But in over 3 decades of practicing urology, I've found that some of the most serious conditions I've ever diagnosed began with nothing more than a small change that someone happened to notice in the mirror. Things like redness, irritation, unusual bumps, swelling, or discharge. These aren't cosmetic concerns. They're early warning signs. And when caught early, they're often much easier to treat. I once had a patient, Richard, age 67, who noticed a dry patch that just didn't go away. He brought it up during a routine visit. It turned out to be something we were able to address early and easily. But if he'd waited, the outcome could have been very different. And if you're uncircumcised, it's especially important to gently retract the foreskin and check underneath. Don't rush. This isn't about being hypervigilant. It's about making sure you're aware. Just like you'd check your tires before a road trip, it's not fear, it's smart maintenance. This habit is easy to skip, but once you build it into your routine, it becomes second nature. And the better you know your body, the quicker you'll catch changes when they appear. But this is only the beginning. What you put in your body before you even reach the bathroom could have a surprising impact on how the rest of your system performs. Let's take a look at that next. If you're still reading and finding these tips useful, leave a 1 in the comments to let me know you're here and following along. 2. Drink first, pee later. For years, even as a practicing doctor, I followed the same routine as most men. Wake up, head straight to the bathroom. It was automatic. The moment you feel that pressure, your brain says, time to go. But after working with thousands of men over 60, I began noticing a quiet but consistent difference. The men who stayed sharp, steady, and had fewer issues with their bladder all seemed to do one simple thing differently. They reached for a glass of water before going to the toilet. It might feel counterintuitive. Why drink water when you already need to urinate? But here's what's actually happening. After sleeping through the night, your body is mildly dehydrated. Your blood thickens a bit, your circulation slows, and your kidneys are operating without enough fluid to work efficiently. A small glass of water first thing helps rehydrate your system and gives your kidneys the support they need to eliminate waste more effectively. Even more importantly, it gets the blood flowing through your pelvis, including to your penis. That boost in circulation is key for better function, both in terms of urination and sexual health. Several patients have told me that this single habit changed everything. Within a few weeks, they reported better flow, less straining, and improved morning erections. Think of your body like an engine on a cold morning. You wouldn't start driving before letting it warm up. The same applies here. Personally, I keep a glass of room temperature water by my bed. Before I even get up, I take a few sips. It's a small change, but it sets the tone for the rest of my day. And now that your system is waking up internally, it's time to help it out externally with just a little bit of movement. No sneakers required. 3. Do a 60-second wake-up stretch. I used to think stretching was for athletes or gym goers, not something for a man in his 60s or 70s. But as I started noticing more stiffness in the mornings, not just in my joints, but in my energy and circulation, I realized I needed a change. What I found was simple but powerful. Light movement first thing in the morning makes a real difference, not just for comfort, but for your blood flow, especially in the areas that matter most for men's health. The penis is a vascular organ. Its health depends on strong, steady circulation. And after a full night of lying still, blood flow to your lower body slows significantly. To jumpstart it again, I recommend a basic 60-second stretch. Nothing intense. I stand beside the bed, take a deep breath, lift my arms overhead, and slowly rotate side to side. Then I gently raise each knee in a slow marching motion. This gets the blood flowing, signals your nervous system to wake up, and provides the pelvic region with a boost in circulation, supporting both erectile function and bladder control. Many of my patients report feeling more alert and more balanced throughout the day after adding this 1 minute of stretching to their routine. It's small, but it works. Many of my patients are genuinely surprised by how different they feel after just a week of adding this 1 minute stretch to their mornings. They report stronger urine flow, fewer nighttime trips to the bathroom, and a noticeable boost in confidence. And it makes perfect sense a warmed-up system works better. Now that we've gotten the blood flowing, let's turn to a signal your body sends every morning, one that many men notice, but few truly understand. It's simple, quiet, and incredibly revealing. If you're still reading and this message is connecting with you, type 1 in the comments to let me know you're with me. Pay attention to your morning erection. This is often where the conversation gets awkward. A lot of men laugh it off or change the subject. But after decades of working closely with men's health, I can tell you your morning erection is not something to ignore. In fact, it's one of the most reliable signs of what's happening inside your body, especially with your heart, hormones, and nervous system. You don't need to track it or overanalyze it. Just notice. Did it happen this morning? Was it firm? Did it fade quickly or last like it used to? This is your body communicating with you. When you wake up with a solid erection, it's a good sign that blood is circulating well, your testosterone is active, and your nervous system is functioning properly. But when that signal disappears, particularly over time, it could mean something deeper is going on. I had a patient Leonard, age 72, who hadn't had a morning erection in over a year. He assumed it was normal aging. But after a checkup, we discovered the early stages of cardiovascular disease. We were able to treat it before it escalated all because of a subtle change he almost dismissed. I know this topic isn't always easy, but once men start paying attention to it, they feel more empowered, not like they're just watching themselves age, but like they're stepping up to take care of what matters. And now, let's go from observation to action. Because what you do in the shower every morning can either support your health or slowly cause irritation you don't see coming. 5. Clean but gently. For most of my life, I believed in the hard scrub and hot water approach to hygiene. A strong soap and a steaming shower made me feel clean and energized. I never thought twice about scrubbing every inch like I was detailing a car. But as I aged, and after treating hundreds of men with the same mindset, I began to realize something important. When it comes to the penis, aggressive cleaning can do more harm than good. The skin in that area is thin, sensitive, and protected by natural oils and beneficial bacteria that help maintain balance. Strong soaps, harsh scrubbing, or water that's too hot can strip away those protections. The result? Dryness, irritation, or even small cracks that can lead to discomfort or infection. Many older men have come into my office worried about burning or redness symptoms they thought were serious. But in many cases, they were simply washing too hard. Now, I recommend keeping it simple. Use warm, not hot, water, and a mild, unscented soap. If you're uncircumcised, gently pull back the foreskin and rinse underneath, no pressure, no rush. Just like brushing your teeth, it's about consistency and care, not force. There's something quietly powerful about treating your body with respect. A few mindful moments in the shower can set the tone for how you carry yourself through the rest of the day. The skin around the penis is especially thin and sensitive, protected by natural oils and beneficial bacteria that help maintain balance. When you use harsh soaps, hot water, or scrub too vigorously, you can strip away that protective barrier. Over time, that leads to dryness, irritation, and sometimes even small cracks in the skin openings for discomfort, rashes, or infections that seem to come out of nowhere. I've had many older men come into my office, concerned about redness or a burning sensation, assuming it was something serious. More often than not, the real culprit was simply overwashing. Woo, clean but not too much. What I now recommend is straightforward, lukewarm water and a mild, unscented soap. If you're uncircumcised, gently pull back the foreskin and rinse underneath, no scrubbing, no force. Like brushing your teeth, it's not about how hard you do it, but how gently and consistently. There's something quietly powerful about taking those few extra seconds in the shower to care for yourself with attention instead of autopilot. It's a sign of respect, not just for your body, but for your well-being. When you treat yourself with care, you move through the day with more confidence and presence. Now, let's talk about what comes next. Because what you put on your plate at breakfast can either support all the good you've done so far or start undoing it. 6. Eat a breakfast that supports your manhood. I'll admit, I didn't always think much about breakfast. Like many men in my generation, I grabbed what was convenient: toast, eggs, maybe some bacon if I had time. It wasn't till later, as both a physician and someone going through the aging process myself, that I realized just how important that first meal is, especially when it comes to protecting sexual and urinary health. Your breakfast choices affect everything from hormone levels and circulation to prostate function. And unfortunately, the typical American breakfast full of processed meat, sugar, and refined carbs often works against you. High levels of saturated fats and sodium can lower testosterone and restrict blood flow, especially to the sensitive tissues of the penis. These days, I start my morning with a bowl of oatmeal topped with chia seeds, walnuts, and a handful of blueberries. Sometimes I add a boiled egg or a slice of whole grain toast with a little avocado. These foods deliver essential nutrients like omega-3 fatty acids, zinc, antioxidants, and nitrates, all of which support stronger erections, better energy, and long-term wellness. One of my patients, Edward, 68, decided to try this change for a month. When he came back in, he said, "Doc, I didn't realize food could make that much of a difference down there." But it can, and it does. So if you've never considered what your penis might appreciate at breakfast, now might be the perfect time to start. Because a few intentional choices at the table can lead to surprising improvements throughout your life. Sit less, move more. Once your body's been fueled with the right food, there's one more hidden habit that could be quietly working against you, and it all comes down to how long you stay seated. I still remember when I first became aware of it, how stiff my hips felt after lingering over breakfast and reading the paper. At first, I brushed it off, but gradually, I noticed more tension, more sluggishness, and even a bit of numbness in places I didn't expect. That got me curious, so I started looking into the connection between prolonged sitting and men's health. What I discovered led me to change how I start every day. When we sit too long, particularly in the morning, when circulation is already slow after a full night's rest, we compress the pelvic floor muscles and restrict blood flow to the lower body. For older men, this reduced circulation isn't just uncomfortable. It can impact erectile strength, bladder control, and even contribute to long-term tissue weakness. In fact, many men don't learn about pelvic floor dysfunction until they're already dealing with its symptoms. What helped me and many of the men I work with was simple. I began setting a timer to get up and walk around for 5 to 10 minutes after breakfast. It's not exercise, just a gentle loop around the house, down the hall, or even out to check the mailbox. It may not sound like much, but this short walk revives your circulatory system, eases pressure in the pelvic area, and gives the lower body what it needs to stay functional. One of my patients put it best, "That little walk made me feel like myself again." And he's right, I felt it too. Our bodies were built for motion, and regular movement is one of the best ways to preserve your strength, vitality, and independence as the years go on. A final word from Dr. Kenton. If you've made it to this point, I want to offer something beyond just health tips. There's a deeper message here, something we don't often say out loud. Because this isn't just about your body, it's about how you view yourself. So thank you. Not just for reading, but for showing up for yourself. For caring enough to pay attention. That matters more than you know. For many men in their 60s, 70s, and beyond, the idea of focusing on their health, especially something as personal as their penis, can feel awkward or even unnecessary. But the truth is, tuning into your body is one of the most powerful and respectful things you can do. You don't need to be perfect. You don't have to fix everything overnight. But if you start small and stay consistent, your body will respond in ways that might surprise you. And more than that, your confidence, your sense of control, and your well-being will grow. If this article spoke to you, consider sharing it with a friend who might need it. Leave a comment and let me know what habit you're going to try first, or ask me a question. I read every single one. And if you'd like to keep getting practical, honest advice designed for your stage of life, don't forget to subscribe and turn on notifications. You're not alone in this, and your best years are still within reach. But the truth is, caring for your body in this way is one of the most respectful and empowering things you can do for yourself. The 7 habits we've explored, from morning inspections and pre-bathroom hydration, to light stretching, paying attention to morning erections, gentle hygiene, thoughtful eating, and simply getting up to move, aren't grand medical interventions. They're quiet, everyday choices. But taken together, they send a powerful message that you're present, that you care, and that your health still matters. I've spoken with countless men who believed it was too late to make changes, or felt too uncomfortable to even start the conversation. And yet, I've watched those same men gain strength, regain function, and reconnect with parts of themselves they thought they'd lost. Not because of any prescription or procedure, but because they chose to listen to their bodies. They chose to care. You don't need to get everything right all at once. You don't have to overhaul your life overnight. But if you begin with one step, stay steady, and give your body the attention it deserves, you might be amazed by what starts to change. Your well-being, your confidence, and your sense of control are still within reach. It just begins with the belief that you're worth the effort. If this message resonated with you, I invite you to share it with someone you care about. Leave a comment below and tell me which habit you plan to try, or let me know what you'd like me to cover next. Because your story matters, and no matter where you are in life, it's never too late to start a new chapter. If this article helped you, consider giving it a like. It tells me that this content is reaching the right people. Pass it on to a friend, a brother, or someone who may be quietly facing similar questions. And please, don't be shy about commenting. Let me know which tip you'll start tomorrow, or ask me something that's been on your mind. I read every comment. And don't forget to subscribe and turn on notifications so you'll never miss advice designed specifically for your health, your confidence, and your quality of life. You're not on this path alone.